Okay, so here we go. Chapter 1 from your fundamentals book. This is historical and contemporary nursing practice. So you can read these learning outcomes here. So number 1 is discussing historical factors and nursing leaders, female and male, who influence the development of nursing. Explain the importance of continuing nursing education, discussing the criteria of a profession and the professionalization of nursing, and describing factors influencing contemporary nursing practice. So when we think about history, you can see this is a very old picture. Maybe some of you have nurses in your family that maybe even had nursing caps, probably not quite like those, but studying the history of nursing really allows us to appreciate the profession and also how far we've come in the role of healthcare. Some of you might find it interesting to find about that there has been nurses or people that maybe weren't termed the word nurse, but there have been people that function as nurses practicing since ancient times. So it's been since the time of Florence Nightingale, which we'll talk about her. She gets a lot of credit because she's the one that determined that nursing was a profession. But the act of nursing itself has been around for a long time. So you can see here that we're going to talk about not just the historical definition, but kind of where we're at right now. So as far as what this says regarding the historical perspectives, that there's been a dramatic change in what nursing has perceived on since it was defined earlier on in history. And nursing has really had a struggle in history for autonomy and professionalization. So what that means is that just means that nurses have really struggled to be able to take action and make judgments on their own, to have that authority to make decisions with a profession knowledge base. So not making decisions that are out of your scope of practice, but within that. So an example of that would be the nurse is working on the unit, and they're able to prioritize their workday and how they want to care for their patients and what patient is going to be seen first, how you're going to go about caring for that patient. So when we think about nursing throughout history, even before we think about societal attitudes regarding women, typically nurses and nursing has been one of the most respected professions, and that's because many people describe nurses as kind, they're patient, they have a good work ethic. Before the mid 1800s, women were really at home. So actually before that, and it isn't really mentioned on this particular slide, men were actually doing more some of the nursing, and maybe it's not maybe in a hospital setting, because those really weren't in existence, but they might be the people on the battlefield, like caring for the wounded, those kind of things. But women historically were the nurturers of their family members, so even though they didn't have a nursing degree, they were doing nursing in a sense. Nurses were also seen as dependent. They needed the doctor. You've seen like those sexy nursing costumes that are sold at the costume stores that they're not even like practical, obviously, but that's one of those figures that nurses in the past were seen as. So in addition to that, when we look at the history, caring, nurturing, those were all attitudes of nurses, but religion also played a significant fact, because caring for others, people giving up of themselves to care for others, putting someone else's needs above your own, those were all important in helping develop nursing. So in the 1990s, they kind of wanted to put a squash to some of these things, like just females only, or nurses are heroes, or sex objects, or whatever the case might be, that there was actually a council put together to help improve the image of nursing. So we're going to talk on the next several slides about some of the historical nursing leaders, and you guys are going to get the opportunity to present about a historical figure. So I'm not going to go into juicy details or go too deep with this because you're going to get to do that. I'm just going to hit on the highlights, and some of them I might get more excited about because I just find it just so, they're all amazing, but some are just so interesting, and how many of them maybe even were born into some sort of privilege, but they used it for the greater good and wanting to help others that were less fortunate. So this is Florence Nightingale. She gets a lot of attention because she's the person or nurse in history that was the first scientist, theorist, nurse researcher, and she's the one that really wanted nurses to have a profession and wanted to train nurses in a school type setting to care for others. So she lived in the 1800s to the early 1900s. And the funny thing is I recently asked a student who I used to have an N100, what do you remember about this class? And the student replied, Florence Nightingale. And I just kind of laughed because there was much more that they did remember once the students were talking about it. But this one is somebody who went against the social norms. She was a socialite, and or at least her parents wanted her to be. They had a lot of money. They wanted her to just get married and be the traditional socialite that her family was part of. But instead, she said that she had a calling of God to become devoted to helping others, and she wanted to do that by being a nurse. So she is somebody that I will let you guys dig into when you learn about her and how she's considered the scientist theorist because she developed the environmental theory about how the environment, the cleanliness of the environment, fresh air really improves the standards or outcomes of people. So she was part of the Crimean War, and she cared for a bunch of injured war wounded soldiers, and so documented her outcomes and what she did for them. So very interesting woman, gets a lot of credit in nursing becoming a profession. Clara Barton is somebody that was actually a school teacher, but she volunteered to be a nurse in the American Civil War, so she probably got some like hands-on training right there, so she didn't have any formal training, but because of that experience, she is the founder or the person that established the American Red Cross, which we're still seeing used for crises today. Mary Eliza Mahoney to be exact. She was the first African American licensed professional nurse. She was also the first woman to be a registered voter in Boston. And this lady just amazes me because she wanted to be a nurse. She decided she wanted to be a nurse when she was in her teenage years. She was actually born in North Carolina to some freed slaves, and they moved from North Carolina to Boston. She was, like I said, around 15 or so. She really wanted to become a nurse. And so she worked her way into, I can't remember what town it was, but she worked in a women and children's hospital. And she worked like any job she could get in there, like janitor, whatever she could get, for 15 years. She did not go to a nursing school until she was 33 years old. And she was the first one trained and become licensed, which I thought was pretty neat. She was very sought after by people in the community. They wanted her to take care of them because she had an amazing bedside manner, very patient, very caring. Her parents also were, I'm not sure if they, when they were freed, maybe if they had gotten some money or they just moved to an area that were very supportive. I felt that that was a time where there was probably definitely some segregation and definitely not equality there. But they actually sent Mary as a child into one of the first integrated schools, which I thought was also interesting. Obviously, I gave you more details, super interesting. She didn't just advocate for African Americans, she advocated for women in general. So pretty cool lady. Moving on to Lillian Wald. Lillian Wald is considered one of the founders of public health nursing, and this was another person that had used her life. I don't know that she was well off. Actually, she had seen a lot of hardship um, in her community. Actually, Lillian was well off. It's all coming back to me now. She was born into some money, but the areas around which she lived, they had a lot of immigrants, and she noted that they had a lot of health problems and just really wanted to help them. So she moved into the neighborhood, which became known as the Henry Street Settlement, and it's in a poor area of New York City slums. And she, with a group of other volunteers, actually started helping improve the health of the families and the people that were living in the area, and again became known as the public health nurse. She developed something called the Henry Street Settlement, which is still in uh, in that area of New York City today, and it's a promotion of health even now. So I'm not going to go into great details because there's a lot of stuff on Lillian Wald. She did a lot for children as well. And I'm moving on to the next person. So Lillian Wald, first public health nurse, founded public health nursing. Margaret Sanger, I'll just say she is a little scandalous. You can look into her. She even had do a little jail time because of her literature that was trying to help prevent um, people from having unwanted pregnancies, to have better birth control. And she did a lot of, helping them understand even natural planning. But she was one of 11 children, and she witnessed a lot of poverty within her own family system. And people would, I don't know if her mother died young. I can't remember all the details. Somebody's going to look into Margaret Sanger and know all these details. But she really wanted to advocate for women's rights and for them to be able to have some thoughts about their own body. And she opened the first birth control clinic in the US. I believe it was called like American Birth Control Clinic or something like that. But in the 1940s, it became known as Planned Parenthood. Mary Breckinridge. Mary Breckinridge grew up in Kentucky. She also had some money, or her family had some money, because they actually sent her to Europe to get some training, and she became a nurse, and she wanted to come back to her rural roots in Kentucky because there was such a high mortality rate, a high death rate among moms and babies in that area. And it had the highest like in the nation because a lot of those people didn't have access to care. So she became a nurse midwife. She trained to become a nurse midwife so she could help deliver babies. And through her frontier health service, so they rode horses and they went into these rural areas with her frontier nursing service and provided care to the moms, care to the babies. She also, it's still open to this day, the first midwifery training schools in the United States. She opened it, and it is in her Kentucky hometown. So pretty neat. Really interesting to do your project on. Men in nursing. So I just want to give you some stats that in the 1970s, like only less than 3% of nurses were men. Last year's statistic was 12% of the working nurses are men. So that's increased. It's continuing to increase. But the schools of nursing for men in the United States were present in the late 1800s until around 1970, 1969. So despite some societal thoughts on that it's a female profession, men have been involved for quite some time, just not in large amounts. And like I had mentioned earlier, that men were the first ones that were caring for people like injured soldiers and whatnot. And in India, they have records of a men's nursing training dated back to 250 BC, which I thought was really interesting. And one of our adjunct faculty, his name's Bobby Lucia, he is a graduate, so he's an alumni from Methodist College, and he became a nurse practitioner, and he also teaches some at our college. And he's really fun to talk to. I just love listening to our graduates. I love listening to um, what they have to say about their profession after they become a nurse. But he says every now and then he'll have that random person that says, "Oh, that's kind of weird, a guy in nursing. Why didn't you become a doctor?" And then he has the opportunity to share about just have a conversation with people about the roles of nurses, the opportunities that nurses have, and the misconceptions that it's a gender sort of role. So, pretty neat. He says he doesn't encounter it very often, but that image that in the past some people might think it's more of a feminine sort of thing has been a barrier to some men coming in. Maybe they were thinking, oh, I don't want a man, I don't want him to put the catheter in or whatever if it's a female. So sometimes it's just generational feelings from the past. Like somebody's great great grandma would be like, I don't want to have a man take care of me because they can't, the only person that's seen me naked is my husband. So those are those are kind of things that are barriers that really have been walls that are being torn down. And I will say that my statistics of having male nursing students in a group, I usually have to every 8 students, I usually have one male. So I'll have to look around the classroom when I go back and see if that holds true. But lots of opportunities for men and women in nursing. So this guy is Luther Christman, and he is somebody that really was fighting to increase the number of males that were entering nursing profession, and really kind of being an advocate for men in nursing, because he himself faced discrimination as a male nurse, and he was the first man to become a dean at a nursing school, and was actually at the Vanderbilt Medical Center. They had a nursing program, and so he became the dean of that. And he was also the first man nominated for the American Nurses Association Hall of Fame. So now we're going to just flip to the types of education or nursing education. So remember back to Florence Nightingale, she's one of the first people that went in to develop schools of nursing. And the types of schools of nursing that were developed early on were really geared to develop nurses that could work in the hospital. Maybe I'm jumping around, I'm not on the right slide, so you're getting a little bit of extra education here. Um, so let me start over on this one. I'm so sorry. Nursing education. So to get your nursing degree, whether it's at Methodist or ICC or Bradley or wherever it would be, it is controlled by a state board of nursing and professional organizations. So we are very varied now. We're not just developing nurses that are only going to work in the hospital. We, as a bachelor's program, definitely focus on critical thinking, promoting health, and maintenance. There's 2 levels that are considered nurses, and that's the RN and the LPN. The LPN is sometimes called an LVN, which stands for Licensed Vocational Nurse, but a lot of people call them LPNs, which means Licensed Practical Nurse. So moving to the next slide. So the types of education programs for an LPN could range anywhere from 9 months to 12 months. Sometimes it's really appealing. People that think they want to become a nurse, they kind of want to test the waters a little. So maybe they'll just go ahead and get a quick start and become an LPN. And they're in this Tri-County area, Central Illinois, they've really decreased the numbers of LPNs working in the hospital setting just because There are limitations based on state to state with what nurses, LPNs or RNs can do. And so LPNs can do like basic patient health assessments, basic patient care. They collaborate with doctors and nurses, but there are some limitations. Like in the state of Illinois, LPNs cannot hang certain IV medications. And so thinking about your patients that are coming to the hospital, they have a lot of IV medications or blood or whatnot. So there were some things that they weren't able to do, but there are areas that they can work, and they can also work themselves up a ladder. Some colleges have ladder programs where they can continue and work their way up to an RN as they're practicing as an LPN. So they take the NCLEX, which is a nursing exam, but it's the nursing exam that's for a practical nurse. So it doesn't have the same types of questions that the NCLEX RN has. And because of some of those restrictions within the hospital or acute care setting, a lot of LPNs have shifted more to long-term care. Some of them also work in providers' offices as well. Oops. So the types of educational programs that you have for registered nurse programs are the diploma, associate, and the bachelor. So the diploma is the program that I went to initially at Methodist. It used to be called Methodist School of Nursing. It was a 3-year program, and it was called nursing school, not nursing college. And it was really geared towards, we had lots and lots of clinical hours. It was really geared towards hospital-based programs. Those have declined. We don't hear about as many diploma programs. I think Graham might be one. I'm not 100% sure. Associate degree is a 2-year program. It takes place in community colleges, and this was begun in the 1950s when there was a nursing shortage, and this woman named Mildred Montag did a proposal saying, hey, we need to get some nurses sooner. We can do a 2-year like technical sort of school for these nurses, and they will have an associate's degree. So we do have associate's degree. I know ICC has an associate's degree nursing program. Then I'm going to talk to you about the baccalaureate program, and that's obviously the one that you're at right now. And this is definitely something that's growing with the enrollment because it's preferred by a lot of hospitals, and we'll talk later about why that is. Some states are actually mandating that nurses that do not hold a bachelor's degree, they have 10 years to get it or they won't be able to work there. So it was called BS 10. And so there was incentive at hospitals to have their nurses go through like an RN to BSN program, which we offer one of those at our hospital as well. And they would maybe get an incentive because you'll hear about Healthy People 2010 that we'll talk about in a little while, about how because the higher level of critical thinking, the higher level to make better judgments for patient safety, they're generally have more responsibility and better career advancement with a bachelor's degree. Now, I want to just tell you that some of you might be listening to this and go, what? I've worked with Sally at the hospital, and she's been a nurse for 30 years, and she is awesome. Sally probably is amazing, and Sally probably has amazing critical thinking skills. However, out the door right now, baccalaureate degree is more prepared. So I'm just putting that out there. I've worked with associate degree, diploma grads, all kinds of people. They get experience, they do awesome, but the baccalaureate degree is preferred. So beyond the baccalaureate program, the master's degree is what your teachers at a minimum hold at the college. And with a master's degree, you could be a nurse educator, you could be a nurse consultant, you could be administration. There's different focuses. There's doctoral programs. So a PhD, a lot of people with a PhD they're going to be more involved in research or nursing education. So, like Dr. Ferguson, Dr. Miller, they are leadership at our college and they have PhDs. Some of your faculty have a PhD as well. DNP is like a doctorate in nursing practice. So for a nurse clinician, so there might be some nurse practitioners that have a DNP as well. Or you can have a DNP and just really be wanting a job in leadership or administration, probably at a place like a hospital because that's more clinical and at the bedside and less research. So regardless of what type of education program you're in as a nurse, there is continuing education that happens. And you might hear of CEUs. It's called Continuing Educational Units. And when you hold just a nursing license, an RN nursing license, you have a minimum in the state of Illinois, a minimum of 20 CEUs that you have to get per 2-year license renewal. Now, I hold another certification in addition to that as a pediatric certified pediatric nurse, and so I have to get additional hours in my specialty area on top of that, which I have to show evidence of every year. So this is the reason for this is to really help nurses continue with their education, and they need to be responsible for best practice. And some states have more, some states have less, but just to help keep everybody updated, and that's part of being a professional. There's other professionals like doctors, lawyers, engineers, CPAs. They also have to do continuing education. So again, that's part of being a profession. So what is a nurse? If I was in the classroom, I would just say, hey, what do you think a nurse is? And you could probably define some words. A lot of people would say it's somebody who cares for the sick. It's somebody that does patient care. If somebody needs help, they go like, I need a nurse. So definitely somebody that's going to help others. So definitions may include caring. Nursing is also considered an art. It's definitely well immersed in science. We want nurses that graduate from here and anywhere. You want a nurse to be client-centered, to be holistic, look at the whole person, be able to adapt, being concerned with promoting health and maintaining health, and also just helping it grow as a profession. I would say that in addition to caring for patients, we're decision makers, we're communicators, we help manage plan of cares, we are advocates for the patient, and we're also teachers. So the scope of nursing is what do? We promote health and wellness to individuals, to communities. We want to promote prevention of illness, so vaccines or immunizations, care for mothers who are pregnant or before the baby's born, when the baby's born, infant care, preventative, like preventing sexually transmitted infections, so a lot of education, maybe even to schools about those sorts of things. Other scopes of nursing practice is restoring health, so it could be directly caring for a sick person like at the hospital. Maybe it's helping with diagnostic and assessment procedures. I picked up some extra hours when I was a newer nurse, and I worked in the mammography area. And so I did breast exams on women, and I would mark if they had lumps or any lesions on their breast. And so that was kind of part of like, even though I wasn't the diagnostic person, I was helping with that process. Consulting with other healthcare professionals, maybe being part of rehabilitation. Caring for the dying. Maybe that's happening at the hospital. Maybe it's home health. Maybe it's an extended care facility. Maybe you're part of a hospice care. There are settings that people will work in besides the acute care hospital. A lot of new grads think, oh, I'm going to work in the hospital. But there are many, many other jobs. Many of you will apply for jobs within a hospital. But there are those other opportunities such as nursing homes, home care, skilled nursing facilities, rehab, community clinics, doctors' offices. There's a lot of things listed here. The Nurse Practice Act is something that mandates the scope of practice for all nurses. And this is a legal act that regulates the profession. All states have a board, a nursing board, but it has to abide by standards of the Nursing Practice Act by American Nurses Association. And so essentially what this does is this makes sure that the nurses, whatever state you're in, that you have knowledge and skills and attitudes that a professional nurse should have. There's also some specialty nursing organizations, and I did mention that I belong to the Pediatric Nurses Association, but there's also Operating Room Nurses Association, there's OB Nurses Association, there's you name it, there's various specialty areas that help make sure that those nurses that hold extra certificates are doing what they're supposed to be doing. So if you're violating the Nurse Practice Act, violations could include not promoting patient safety, being dishonest, using controlled substances, improper delegation or supervision. That means that you told somebody to go do something that wasn't within their scope of practice, or you failed to supervise somebody that you were in charge of, or poor documentation. And we'll go in during this course into each of these things, but one of the biggest things that the Nursing Practice Act does is to make sure that patients are safe wherever you're at, whatever state you're in. You're traveling, you go to the hospital. Because of the Nurse Practice Act, there should be certain ways in which the hospital and nurses function. Other roles and functions of the nurse are listed here. Caregiver, communicator, teacher, kind of mentioned those things earlier. Advocate, so really like advocating for that patient. Maybe that patient shared with you something, or you know as the nurse that this patient is not going to do as well at home without certain resources, so you're voicing that to the providers and advocating for your patient. Counselors, while we're not trained counselors, you're going to learn how to communicate in a way that's therapeutic to help the client work through maybe some of their issues that they're having at the hospital and help them improve their relationship. We're also change agents. We're role models. We want to help encourage our patients to make positive changes, and sometimes that's helping them adapt to something new, and also being a role model. Nurses are leaders, managers, case managers. They also use research to improve client care. So maybe you're not at the bachelor's level, a bachelor's graduate, you are going to use research to improve your client's care. You're going to do that as a student nurse in a bachelor's program, but you may not be conducting research. So somebody with a PhD is going to be conducting research, but you could use research to improve client care. So an example of that is evidence-based practice. So you might read an article or articles about ways, new evidence, new findings that promote better outcomes for patients, and then making changes on your unit or sharing that article with your manager who can help make change. Or maybe you're serving on a board at the hospital that you work at that is using best practice to make changes. So one of the main things that comes to my mind when I think about that is evidence-based practice regarding infection control. So there's processes that have been adapted and developed by nurses with bachelor's degrees that change the way that they do things in the hospital to reduce catheter-acquired urinary tract infections, for instance. That's one example. Turning patients and developing policies about turning patients on their sides to prevent skin breakdown and doing that like every single hour. So there's all kinds of things from large to small that you can use evidence-based practice to help develop policies to make a better difference. You can expand your career role as a nurse. So just becoming a nurse could be just the beginning. So nurse practitioner, clinical nurse specialist, a nurse anesthetist, a nurse midwife, a nurse researcher, an administrator, and an educator, an entrepreneur, or a forensic nurse. There's also SANE nurses. There are sexually assault trauma nurses. Sometimes they're just bachelor's prepared nurses that get extra training. So again, the sky is the limit for expanding your career as a nurse. But what makes a nursing a profession? Now, this is where I kind of started talking to you about it earlier, because those thoughts were coming to my mind on a wrong slide. So a profession is an occupation that requires extensive education, special knowledge, skill, and preparation. Um, and so you are going to be part of a profession. And professionalism has a lot to do with the type of character. Your book defines it as professionalism as professional character, spirit, and methods. Essentially, it's just a way of life that demonstrates commitment to your profession. So even when you are out in public, if you're a nurse, you're representing your profession. So I will have a whole time that we'll talk about like representing yourself as a profession and being careful about that when you're on social media and whatnot. That will come at a later time when we talk about professionalism. But back to Florence Nightingale, she's somebody that really defined nursing as a profession and made the first efforts for that to happen by having a specialized education. So that is one of the criteria, having a specialized education. Whether it's your diploma program, an associate's degree, a bachelor's degree, master's, doctorate, that's a specialized education. And they have a body of knowledge. There's frameworks to help guide the knowledge that a nurse in a profession is going to obtain. A profession of nursing has a service orientation. So altruism, that just means putting others above yourself. So serving others. But it's also guided by rules, policies, and ethics. It's not what you particularly think is correct. There's definitely guidelines that surround it. Other criteria of a profession includes ongoing research. It's one of the reasons why we look at evidence-based practice. Also why there's continuing education. There's a code of ethics. And we need to do what's right regardless of what you might think. Autonomy is where you're able to have some independence at work, and you're also accountable for your own actions. And then it is governed by the American Nurses Association, which helps advance the nursing profession by having standards. So it's governance. So the profession is governed by the ANA. Now, when you get out of nursing school, you are going to be considered a novice nurse. So there is something called Benner's Stages of Novice to Expert, and it was developed by a nurse named Patricia Benner in the 1980s, and she was describing how nursing skills develop over time. So when you get out, you have no experience. You're just fresh with your little toolbox with a few little tools in it, and you're going to work those first year or so to get some experience, and then you will become an advanced beginner. So you have some limited experience, not a lot, but you've got probably a good year on now, and then you start to develop. 2 to 3 years in of experience, you will become competent. So nurses that graduate that think that they need to know everything, you're just not. So those are things that are going to develop over time, as I mentioned. So when you get to become competent, you're really doing well with prioritization. You're really you're just becoming more skilled in that way. Stage 4 is usually about 3 to 5 years of experience, and you're really seeing things with a holistic understanding of the client. You can just look at somebody and just know, I bet this is going on, this is going on. You could see 3 patients and know who you're going to see first and probably what's going on, even though you can't diagnose them with a medical diagnosis. Stage 5 is the expert. No longer do you require a lot of extra help. You can just kind of look. You do require, you have to work within your scope, but you already know what's expected, and you just kind of have the intuition and able to analyze things quickly. And so that usually comes after 5 years of practice. Now, let's say that you were a labor and delivery nurse for 8 years, and then you decide that you want to change things up and go work in the ER. Well, you're not a novice, and you definitely you could be anywhere from an advanced beginner to competent, because there's going to be things that you just know, but there's a whole lot of things that you don't know. So you could actually move down the levels and then work your way back up again, depending on your job situation. So here's just an example of novice to expert with explanations of each of those. So we have to think about, there are issues within our society that happen that affect how nurses practice, that affect access to care, and we're going to talk about some of those issues in the next few slides. So your book was published in 2016, so there's been probably some changes, definitely, since it was published, but the Affordable Care Act was passed in 2010, and that's one of the main reasons why nurses are really been pushed to get higher levels of education, because the Institute of Medicine, the IOM, published this report stating that nurses need to practice to the highest level of standards to promote best safety for your patients. So I think that's really the main points that I would like to mention on there. I feel like there's something else. I think with the Affordable Care Act, I guess that was it. What is the Affordable Care Act? That is really governmental policy that affects healthcare to help improve access to healthcare and quality care. So quality and safety of healthcare is very, very important, and it's expected. It's expected that wherever you go, that consistency should be happening, and that regardless of who you are or your ability to pay your bill, that the best practice should be used for the patient. So the Institute of Medicine has 6 competencies that nurses are expected to practice by: patient-centered care, be able to be a good team member and collaborate, that's work with other practices, whether it's pharmacy, physical therapy, dietary, the physician, that you're using evidence-based practice, and that you're consistently evaluating things and making improvements to promote quality and safety, and that you're using informatics, so collecting data, using technology to be helpful. So it's really important, and it's bolded and underlined, that the Institute of Medicine, according to the IOM, quality and safety are the leading issues in healthcare, and those are contributing to unintentional cost and poor outcomes. So if you're lacking in these things, these 6 competencies, if you're lacking in these competencies, there's likely unnecessary costs and likely poor outcomes happening to your patients. So consumer demands, it's the right of all people, not just people who are fortunate enough to have the money to pay, or I think your book has the quotes of privileges of the rich to receive good health care. And that's the public society is agreeing with that we're changing the public view, like it's the right of all people, again, not just for the rich. So we need to have checkups available. People need to be active participants, able to make some decisions in their care that they get as well. So family structures are also changing. We don't always have a nuclear family. Sometimes we have young moms, single moms. Sometimes we have grandparents raising children, or raising grandchildren rather. And so there might be the need for nurses to bridge the gap in providing resources, education, whatever the case might be, to promote health, whether it's preventative vaccinations, calling moms up, seeing how they're doing with their little toddler, doing home visits, whatever that is. And we have some resources in our community that you might even be able to be part of during the time that you're a nursing student. Science and technology. Obviously, we always need to stay abreast on the newest things that are out there, and that's why that continuing education piece is so crucial. In whatever organization you work at, they're going to keep you up to date on the newest technologies that are coming in. So I think that's the main thing. Robotics are being used, the space program technology. So like there are surgeries that is being done in hospitals with robotic arms and different things, laparoscopic procedures that this technology was like space age, if you want to refer to it as that, at one point. Using informatics, telehealth, and telenursing. So we obviously have some great things available at our fingertips through the internet. We also have telehealth. So telehealth and telenursing, if you're a telehealth nurse and you live here in Illinois, you might be crossing state boundaries, but you might not have a nursing license in that other state. So telehealth recognizes that one nurse might be providing information to another nurse across a state boundary. And in the past, that caused licensure issues, but they're recognizing that there are no state boundaries with that. So medical equipment is being used to help promote patient care. Legislation. There are some nurses that are really involved with legislation, and you might even partake in going and lobbying for some things that affect nursing. Let's see, that's the legislation for nurses, but there's something called the Patient Self-Determination Act, that every patient has the right to accept or refuse medical care and also to use advance directives. So advance directives are making choices about things like if I had advance directives, maybe I would say I don't want to be intubated, or I do not want to be resuscitated if my heart stops, or I want to have every life-saving measure done. I could make advance directives. And if I was unable to speak, those advance directives would be followed. Legislation also kind of rules like what the nurses are able to do within their state, as well as nurse practitioners. Some nurse practitioners need to have physician oversight. Some don't need to. So because of that, I think there's like 27 states that say that they don't need to have oversight from a physician. And because of that, that makes it difficult for some nurses to move state to state in practice because the rules are so different. Let's see, the consensus model in 2008 was trying to get more of the states to be, I guess, similar in the way that they regulate advanced practice nurses. So demography is a study of population, and the nurse's role in this would be assessing things like statistics about the population, morbidity, mortality rate, the age group of people, where people are living, just to help promote health and lifestyle changes. So we know demography of the United States, the baby boomers are aging up, and there's going to be a lot of need in long-term care facilities. We also know that hospitals have a nursing shortage. We know that more people don't live in the country, they're moving to the cities, so there could be issues with pollution. Now we have coronavirus or different things. So there's a lot of demographics that are looked at to see how healthcare can be improved, and nurses can be part of that sometimes. Currently, we have a nursing shortage, and I just mentioned on the previous slide that the baby boomers are aging up. We're going to have coming up in the really near future a definite nursing shortage. We already have one. Unfortunately, there's a high turnover rate with nurses, and we will talk all about that at some point, but if I was in class, I'd ask you why you think that is. Some of it is if you have a nursing shortage, that means you have a lot of patients, and that can do a lot of wear and tear on your body. It can do a lot on you emotionally. So it's real important that when you go to get a job, that you really look at, I would want to know, what's the turnover rate here? What's your rate of retention? Why do people stay here? Ask to shadow a day with a nurse just so you can see what is that life like. Um, so I'm not going to, we'll talk a lot more about safety and things, but the American Nurses Association, it is something that will go on your behalf to try to make sure that you have a safe um, place to work. And I think that might be on the next slide. Nursing associations, nope, that is not the next slide. Nursing associations are part of colleges, for instance. So our college, the one you're going to right now, we are accredited, which is voluntary. We have the Commission of Collegiate Nursing Education, the CCNE, come in and take a look at our curriculum, take a look at our clinical practice, and make sure that we are meeting the standards of quality nursing programs, and we are. So the CCNE evaluates bachelor's and master's degree programs, and the ACEN is a commission for education that looks at all levels of nursing. So benefits of being part of a nursing organization: it helps nurses stay up to date on changes. It also gives you a broader perspective of things that are going on. It helps you have access to continuing education programs and getting certification. So you can be part of the American Nurses Association. It is a professional organization. You can be involved on making decisions, political action committees, the National League for Nursing. There's all kinds of, I belong to a couple of these, the National League of Nursing and the Pediatric Nurses Association. There's some things that nursing organizations that student nurses can actually get involved in. The National Student Nurses Association, we actually have an SNA chapter at our college. There's also honor societies that you can be part of as well, and it focuses not on like social things but professional. Like there are some faculty at your college that are members of Sigma Theta Tau, and it helps, it focuses on accomplishments as a professional, but not just celebrating those things, but providing those change makers with some good resources to help make changes for students and the college and things. And that is the end of the slideshow, and then we will do chapter 2 hopefully in class.